Hi, my name is Emily, and I'm going to be talking about a very big epidemic that is going on in the United States. Unfortunately, someone knows somebody that has fallen into opioid abuse, or knows someone, or has a friend or family member that knows somebody that's affected by it. The special person in my life who struggled with opioid or substance abuse was my father. He was a cocaine user, and he was also a dealer. Nothing was more important to him than using. It didn't matter whether it was my relationship with him when I was younger or his marriage with my mom. I'm fortunate to say that he was a substance abuser because he was sentenced to prison. In prison, he was able to sober up and he was able to reflect on all of his actions. My father is one of the lucky ones. It affects every race, gender, profession, socioeconomic status. It doesn't discriminate. New York has placed new laws to help reduce the amount of overdoses and gives resources to addicts to find a road to recovery. Fortunately, in New York, one of the most well-known hospitals, New York Presbyterian, implemented to help addicts. Communities are also saving many lives, finding ways to battle addiction, and they too have stepped forward to help. I haven't been directly involved in any of these programs. I do have patients that do come to the hospital with a history or maybe current substance abuse problems that does interfere with their medical care, but I do primarily work in an oncology setting. Opioid abuse is well known throughout the country, but some may not know the statistics. According to HHS.gov, an estimated 130 or more people die from overdoses daily, which is about 47,600 deaths in 2018 alone. This is clearly a large number, and interventions need to be placed to start reducing these numbers. According to RehabSpot, 11 million American men and women use opioids that were medically prescribed, and 1 million abuse heroin. 23% of people who try heroin develop a life-altering addiction. We have to remember that this number includes everybody, meaning again, race, profession, socioeconomic status, everyone. New York Presbyterian has come up with the Relay program. It was launched in 2017, and the program operates in 7 emergency rooms across the city and will increase to 15 by June of 2020. Relay has wellness advocates. These wellness advocates have personal experiences with substance abuse. Once someone is in the emergency room and has been identified as a candidate for the program, the wellness advocate will arrive within 1 hour of being called. This program provides patients with Narcan kits, referrals to medication-assisted programs like methadone and Suboxone, and social services. Patients are able to work with their advocates for up to 90 days, which is very good, as this can help with continuing care after they're discharged from the emergency room. This program is really important to New York because according to the New York City Department of Health and Mental Hygiene, we experienced the highest record of unintentional drug overdoses in 2017, which was 1,487. The Relay program, I believe, coincides with the health belief model. I believe this is because one of the beliefs of the model is having an eye-opening experience. Also, that there will be adverse effects if they don't change, and that the changed behavior will prevent those effects. A candidate for the Relay program is someone that has come by a near-death experience. They've come to the emergency room after having an overdose. Having this near-death experience then provides a small window of opportunity for the Relay program to come in and offer their services. Relay offering their services gives the addicts a moment to reflect, and this happens to give them the resources that they need to battle their addiction and head on the road to recovery. As I mentioned, my father used to be an addict. I was very young then, and I wasn't able to understand how to help him or what was even happening. Growing up, I really started to analyze my father's situation, and I realized that it affected so many more people and families than I realized. To get a better understanding, I had a conversation with my dad about what it was like for him and the challenges he faced when trying to get sober. According to my dad, he says that recovering was difficult, but he saw so many others that had stronger addictions, and it was really disheartening to see them suffer without having any sort of resources to help. I've learned from my father's mistakes and stay away from people and situations and areas that have high drugs, so I don't fall into any of those situations. I work in oncology, so it's hard because a lot of these patients come in or currently or have a past history of substance abuse. This makes it difficult for pain management as they have built a very big tolerance, so getting their pain managed is very difficult. Usually palliative or pain management has to be called to try and help them. For the future, I think education is a really big part, especially with newly diagnosed cancer patients. This way we can teach them about what the opioids are, how addictive they can be, and that way they can find other methods of pain management so they don't solely rely on these opioids. Opioid abuse is an epidemic and again doesn't discriminate against anyone, so education needs to be provided as much as possible. Many different organizations are coming up with different ways of having programs similar to the Relay program, which is important because sources need to be accessible to the public. My father's been sober for about 10 years, so it proves that it can actually be done. We just have to find ways to lead people in the right direction. Thank you.